When taxi driver Derrick Bird went on a 4-hour killing spree randomly shooting passers-by along quiet Cumbrian roads, the area's emergency services immediately launched into crisis mode. The tragic events of June 2nd, 2010 claimed 12 lives, yet 11 gunshot victims received life-saving treatment in the small town of Whitehaven. Not a single casualty reaching West Cumberland Hospital's modest A&E department alive died from their injuries.
Yes, Colin, we're about to hear that 7 people are now in hospital, 1 person released over the course of today, and here we have 2 clinicians.
I would like to start by offering my sympathy and condolences to all affected by the devastating events that have unfolded since yesterday morning.
June the 2nd was a tragic day, which created immense challenges for us. We'd already had, only 10 days before, another tragic incident in Cumbria with the Keswick school bus crash. We'd already spent considerable hours managing that incident as a hospital response service, and this call came in on the day, and it created immense challenges for us.
It was a slightly cloudy morning, normal morning, and the initial story is we're going to be receiving a patient with gunshot injuries from in town, from a shotgun. And within a very short period of time it's apparent that we're going to be receiving multiple gunshot injuries from shotgun blasts. And the department moves into major incident mode. So this is a CT scan of one of the patients from the major incident who had a gunshot wound to the chest. It was extremely confusing. The information regarding the shootings was coming in from multiple bystander reports. It wasn't clear how many casualties we'd be receiving. It wasn't clear how severe their injuries were. It wasn't clear when we'd be receiving them, nor was it clear when they would stop coming, when the situation was under control.
By chance, the chief executive of North Cumbria University Hospitals Trust, Carole Heatley, had completed a crisis management module through the Tuck Executive Education Programme only a month earlier. A vital tool in overseeing the hospital's astonishing emergency response.
Carole's role and input was crucial right from the outset, and her having attended the Tuck programme was really fortunate, because at times like this you need your chief executive in support, doing various strategic matters, handling press, media, policy, politics, and the agenda goes on, to allow someone like me to concentrate on managing the incident.
It's very important for staff in a major incident to know that their work is being appreciated by management staff. In the early stages of a major incident, the last thing I want is too many managers in the way, because we need clinicians on the shop floor of the right level managing patients. But as the incident progresses and people start to move on from the emergency department and we start to be able to catch our breath, it's also important that the chief executive makes a visible presence so staff can appreciate that their work is understood and heard, if you like, in management circles. And I think she got that balance very well.
Communication is key in this. This was a very tragic incident and was really difficult for the staff involved and the people like myself that were leading the incident control. So aspects of communication were vital. Being decisive in that, as Carole was vital. You know, as a leader of any organisation, you have to have that inner ability to manage situations, and all leaders have that. But what was clear was items from the Tuck programme that were fresh in Carole's mind were clearly enabled us to manage the decisiveness of incident control and the decisiveness of response, on top of your natural ability as a leader to give good steer to your colleagues.
And we see here pellets throughout the chest cavity, and in fact 2 pellets on either side of the aorta. The incident was managed as well as it could have done under the circumstances. We were able to receive casualties, we were able to appropriately manage them in a timely fashion. Everybody that got here from the incident alive survived. They all got appropriate treatment in a timely fashion. And we also were able to manage the international media storm that came from this. without it impeding too much upon the clinical activities of the hospital.
What's your name, sir? What's your name, sir?
Are you still setting up?
No, we're ready. What's your name, sir?
Okay. The TUC programme clearly had some absolute benefits for us. We're proud of the response that we gave at the time. We hope the people of West Cumbria are proud of what we did. We're immensely proud of the accident and emergency department in what was a very, very sad situation. There were clear benefits in terms of the leadership Carole was able to give from the TUC programme. So from my point of view, on that basis, it would come highly recommended.